Today I will teach you about varicose vein. Varicose vein, these are the veins which are dilated and tortuous. Veins which are dilated and tortuous are the varicose veins. Veins tendency to show the varicosities means which are the veins which there are many veins in our body, but there are some veins which have a tendency to show varicosities. These are veins of the lower limb, spermatic veins, mainly the varicocele, esophageal vein, esophageal varices, hemorrhoidal veins like hemorrhoids. Etiology of the varicose vein. As a sequelae of the venous thrombosis, there will be incompetence of the walls, like in D vein thrombosis. After the recanalization of the thrombus, there will be a irreparable incompetence of the valves. This varicose vein, it is not seen in the animals, mainly seen in the humans because of the erect posture in the human. Third etiology is long standing hours, like seen in conductors, drivers of the trams. It is not uncommon in the women, mainly it is more common in the women than men, mainly 10:1 ratio of the women is to men. Tone and the contractility of the muscles of the lower limb. If the contractility is poor and the tone has been decreased, then predisposing to varicose vein. Then these are all the primary cause of the varicose vein, and there are secondary causes of the varicose vein. When there is obstruction to the venous return, like the tumors in the abdomen, abdominal tumors, fibroid, ovarian cyst, abdominal lymphadenopathy, pregnancy, colon loaded with feces, retroperitoneal fibrosis, ascites. Then hormonals, progesterone. It is seen that progesterone, mainly a hormone of pregnancy, is responsible for occurrence of the varicose vein in the female. Younger age group, in younger there will be congenital AV fistula, mean there will be a blood flow from the artery to a vein with high pressure. Now on examination history, what we all will ask. First, age, it is seen in all age group, but the middle age group is mainly the sufferers. Like as I've already said, more common in women than male, 10:1 ratio. Ethnicity is like it is poorly seen in Africa and Far East. Occupation, like prolonged standing, or the occupation involving excessive muscle contraction like rickshaw pullers. Symptoms will be a pain, mainly a aching sensation whole of the leg, confined to the lower part of the leg more at the end of the day, and it can be according to the position of the varicose vein, like short saphenous vein or the great saphenous or the long saphenous vein. Great or long saphenous vein, medial side of the leg. Short saphenous vein, posterior side of the leg. I will tell you the position of the long and short varicose vein later. Pain will be worse when stand long time relieved lies down. It is not the varicose vein which produce the symptoms, it is mainly a disordered psychology. The asymptomatic varicose vein or the severe symptoms. There can be a varicose vein which will be asymptomatic, or it can be having the severe symptoms with very few visible varicose veins. Therefore, this proves that varicose vein itself are not responsible for the symptoms. DVT patient, if patient have DVT, they will be bursting pain while walking. Other history we have to ask about night cramps, ankle swelling at the end of day, itching of the skin of the leg, or the ulcers, venous ulcers mainly seen on medial malleolus. In case of DVT, patient will have difficulty in standing or walking. Any other complaints than varicose vein itself, like constipation, swelling in abdomen, mainly we have to ask to rule out any intra-abdominal cause of the varicose vein, as there will be obstruction to the vein flow, venous return. DVT, there will be a difficulty in standing on walking, because when we walk, the blood flow from superficial vein to the D vein. As a D vein are thrombosed, blood will not able to flow from superficial to the deep system. Past history. In past history, we will ask for any previous history of operation of the varicose vein, or the injection sclerotherapy treatment has to be done. as these operation can cause the DVT and maybe the cause of varicose vein now. Rest we will continue in the next video.